Hello, everyone. I'm Dr. Marty Ross, and tonight's another Conversations with Marty Ross MD. We get to talk about Lyme disease tonight, and hopefully you get some information that will help you with your treatment and learn a few things. For those of you that are new here, welcome. And I also see a number of familiar names back on my message board as well, too. So to you, those of you returning, I'm glad to see you keep getting some value out of this and you keep coming back. For you new people, I'm glad you're here. And there's a couple ways to participate. Number one, you can listen to the questions as I read them and as I show them on the screen, because I actually do show them in the live version. You get to see them. And then see how I respond, see what kind of information you get from that. The other way is to actually write a question. Be bold on your first time and write a question to me. How you write a question to me is on your screen on the right-hand side at the bottom is a chat box. You can write your question to me in that chat box. The only thing logistically that I ask is that you don't hit the enter key until the whole question is written. Each time you click the enter key to send me it actually sends the question to me. And so if you're trying to click the enter key to create paragraphs, that doesn't work. Okay, it actually sends a full question to me. This is our second webinar for January, and I have another one scheduled for next week. So I hope that you'll participate in that too. I am creating a recording tonight's webinar, and tomorrow morning, somewhere before 9:30 a.m. in the morning, you'll get an email from me announcing that recording is ready to be seen with links on how you can reach that recording. But also you'll get in that email will be a link to sign up for next week's webinar as well too. So I hope you'll join me next week for that webinar too. I think that's about all I have to say right now. So let's go ahead and get started here, and I'll take the first question. All right. Hello, Bob. Let's see. Hi, Dr. Ross. I've been treating mold toxicity for 7 months, and my levels have come down. We have moved to a new home. I received my real-time lab report last week. I would like your opinion on whether I should continue treating or stop. My current levels are trichocethene 0.136, which is just slightly above normal. Slightly above the equivocal range, which I call normal. Gliotoxin 1.311, zearalenone 0.68, ochratoxin, aflatoxin are not present. So if I just look at this, just so you know, what I see is that you have slight elevation of the trichocethene and slight elevation of the gliotoxin, basically. Your zearalenone, I would call, because it's in the equivocal range, I wouldn't worry about that. And your ochratoxin and aflatoxin are not there. My current symptoms are mostly fatigue and some body pain. Treating for yeast is my next plan of action. Any thoughts or recommendations would be appreciated. So, so what I would say is that the fatigue and the body pains can be seen if you still have mold toxins in you, and your testing suggests you still do. My goal generally when I treat my patients here for mold toxicity that have mold toxicity is to try to get the mold toxin levels down into at least the equivocal range. So that means that you're still elevated on that trichocethene and the gliotoxin. And in addition, you're having symptoms. So we can't just treat a test. So if the test looks abnormal, but you have no symptoms of a condition, then I don't treat that condition, okay? But if you do have symptoms suggesting it, then I do continue to treat. Now, you do raise another issue, and that is there something else leading to those symptoms, okay? So when we look at the conditions of Lyme disease and the tick-borne co-infections, and we look at mold toxicity, and we look at too many yeast living in the intestines, they have similar symptoms. And the reason that they have similar symptoms is that these different conditions trigger the immune system to overproduce a group of inflammation chemicals called cytokines, okay? So Lyme symptoms are cytokine symptoms, mold toxicity symptoms are cytokine symptoms, and yeast overgrowth symptoms, the majority are cytokine symptoms, all right? So partly what my job is when working with patients is to try to figure out what's the cause of those increased cytokines. So cytokines are good and bad. On the good side, they cause more white blood cells to be made. They draw the white blood cells to where a toxin or an infection is, and they help those white blood cells work better. That's good. We want a decent level of cytokines, not an excessive amount. Okay. The trouble is with mold toxicity and with yeast overgrowth in the intestines and with Lyme and co-infection, sometimes the immune system doesn't do a good job of getting rid of these invaders. And it winds up working harder and harder and makes too many cytokines to help turn itself on more. Too many cytokines give you a lot of symptoms, okay? So it is, it's true that you have symptoms, the fatigue and the achiness that could be part of mold toxicity, because mold toxicity are excess cytokine symptoms. But yeast overgrowing in the intestines can also cause too many cytokines to be made and give you similar problems, all right? So to consider if you might have too many yeast, in addition to fatigue, brain fog, body pain, people often with yeast will have some other things. And so one of those is excessive sugar cravings, intestinal gassiness and bloating. Too many yeast in the intestines also produces toxins that get into your bloodstream and interact with your skin, and that can lead to pimples and acne and skin rashes as well too. And in females will have vaginal itching and vaginal discharge sometimes if they have too many yeast in the intestines as well. All right. So if you have a number of symptoms also suggesting too many yeast, you might also, if you were a patient of mine, I would also treat yeast, intestinal yeast overgrowth, at the same time I'm treating for the mold toxicity. Okay, I would do both. All right. And so I don't know, because I don't get to ask you those questions as to whether you have enough symptoms to tell me that you have too many yeast, but those are some things to consider as well too. Okay. All right. So for those of you that are not familiar, I'm going to show you some further information that you can look at to help figure out if you might have too many yeast. And so I'm going to turn a screen share on here. All right, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. And here there's a lot of information I have. Most of it is under this online Lyme guide section. In addition, under this tab here, you can find my treatment protocol, the Ross Lyme support protocol. This tab here, if you ever get an acute tick bite and you want to know if you should be on antibiotics or how long, take a look at that article there. This is my webinars tab, and then this is where you'll find my new book. That anyhow, over here, this is the online Lyme guide, okay? And so in here, I have a section on yeast, and this is about intestinal yeast. And there's an article called A Silent Problem, Is It Yeast? And I would read this for information about how do you determine if you have too many yeast in the intestines, okay? And if you do, this article called Kills and Prevents Yeast, a brief guide, goes into different options you have, both natural and prescription, to help take care of too many yeast too, okay? All right. Wow, while we're at it, I have to do it. Okay, so this is my new book, Marty Ross MD. It's my Hacking Lyme Disease. This is a compilation of about 40 key articles from my Lyme information site. A lot of people have approached me to say they wish I would have some of my stuff in a book. And so what I did is I plucked out 40 of the most important pieces I have on my site and put them into a book. All right. So if you want to know more about what's in this book to see if this is right for you, take a look here. I get down into, I even give you the table of contents so you can see what kind of articles I have in here. And then you can also read the introduction if you want to by clicking there. At this point, I published it yesterday, and right now it is available through Amazon as a paperback and Kindle. And I am going to be having copies of it to sell through my supplement store, but they're going to take about another week and a half to 2 weeks for me to get. So right now, you can't get it through my store. You can get it on Kindle. You can get it on paperback. I would go and get it on paperback rather than Kindle, because it doesn't make much sense to pay for it on Kindle when you can read it electronically online through this site. A lot of the information is available on this site. But the reason I have a book is it's something you can carry around. You can write in it. And there's room in the margins to write on it. These are things you can bring your doctors and show them for information that they might find helpful as well too. Okay. So anyhow, it's been released. I officially published it yesterday. Okay. All right. All right. There you go, Bob. Good luck to you. Hello, Lynn. Let's see. Hi, Dr. Ross. My real-time labs test came back with these results. Ochratoxin A 3.058, trichosethine 0.311, aflatoxin 1.013, gliotoxin 3.029, zearalenone 1.307. I had done a challenge of taking glutathione and sweating for several days beforehand to flush toxins out of the tissues. How significant are the results like this? Do they mean that mold is necessarily part of my pain problem, and what might be a good treatment? Also, last time I submitted a question about Th1 dominant, and you asked how I know I'm Th1 dominant. A practitioner suggested it because things that he considers immune Th1 stimulants like golden seal, berberine, olive leaf extract, Chinese skullcap are all significantly increase my pain. I'm interested to know your thoughts on this and how to evaluate Th1 dominance. So what I would tell you, there's not really good testing we can do to determine whether a person is Th1 dominant or not. So briefly about that, everyone. Th1 is a part of the immune system. These are the cells that attack germs. These would be your T white blood cells, your macrophages that fight viruses, but the cells that actually attack a known infection. Okay, they're the offensive squad. All right. And then we also have another way to look at the immune system. There's another components which are called Th2 and Th17. Collectively, Th2 and Th17, I call the defenders, the defense system. Okay. So Th2 is made up of your white blood cells, a type called B cells that make antibodies, and those antibodies circulate to help deal with invaders from the past to keep them from infecting you again. Also, there are macrophages that release histamines, and then there's autoimmune cells, okay? Th17 is made up of various types of white blood cells that lie right underneath your skin and your mucous membranes that try to block germs from getting through. And these blockers don't even need to know what the germ is. They just uniformly will try to block any germs that get through. One of the things that predominantly happens when you have chronic Lyme that can happen is often you'll get Th2, Th17 dominant, and those Th2, Th17 produces cytokines that lead to inflammation and lead to problems, but also those cytokines suppress Th1. Okay, now your physician's way of trying to figure out if you're claiming you're Th1 dominant because you react to various antimicrobial herbs is not entirely correct. The reason that you may be responding and getting worse on these herbs is they may be killing germs and you may be having a Herxheimer reaction. And the reason you may be getting a lot of germ killing is that the Th1 isn't doing well itself. Okay, so I'm not sure that I actually agree with your practitioner saying that you are Th1 dominant, because usually the condition with people with chronic illnesses is they're actually Th1 suppressed and they have excessive Th2, Th17 actually. Okay, that's the typical condition. And the way your practitioner has come up with this idea, I don't fully agree with that as a way to surmise that. Okay, all right. In terms of your toxins, yeah, I would say you've got some significant elevations. Your ochratoxin is pretty high. Trichosethine is pretty high. Trichosethine, everyone, is black mold. Your aflatoxin is up a bit. The gliotoxin is definitely elevated. So you have a broad range of different toxins that are elevated. And when you see a picture like this, it usually means you have been or maybe currently exposed to a building that has mold behind the walls. All right. Now, the reason I just said has been or in the past may have had or that you currently have is I have no way of telling where they came from. So the issue with mold toxicity is that there's about 25% of us that have a genetic programming error where when we breathe in mold toxins from the world around us, we breathe them into our blood, and they get absorbed into the blood. And then what's supposed to happen in 75% is some of our white blood cells will see them and tag them. other white blood cells will come in and break those toxins down, and we never had trouble from them. Okay. But in 25% of people, due to the genetic programming error, those white blood cells don't get tagged and they don't get broken down. Then what happens is they go to the liver. The liver is supposed to try to clean them out because they're fat-based toxins, but the liver doesn't handle them well either. And eventually they go out into the intestines via the liver, and out in the intestines, they get reabsorbed again right back into your bloodstream. So you just get this endless loop of toxins going on. And you could have accumulated these anytime in the past, or they may be in your environment right now. Okay. So the problem with having too many toxins in you is they have direct effects on how your body, your nerves work and how your mitochondria work. So they make it so you have a hard time generating energy in the mitochondria. They can give you neuropathy. They have a direct toxic effect on the brain, for instance, too. Okay. But the other thing that they do is they trigger excess cytokines. Okay. And so too many cytokines make it so you can't think, give you fatigue, can make you hurt all over, interfere with correct functioning of your thyroid, your adrenal glands, you name it. The whole list of symptoms, we call it Lyme symptoms, are actually the same symptoms we see in mold toxicity, okay? So if you have a lot of those symptoms I was just telling you about, yeah, I probably would treat for this if you were my patient, okay? All right, now, I can't design a specific treatment program for you because I'm not your doctor, okay? I'm here in these webinars discussing ideas for you to consider to talk with your doctor about, but I don't know enough about your health right now, generally, all the things going on, to decide what is the best way to proceed, all right? What is the binder I would put you on? How much of that binder would I put you on? What other things would I do for you to treat this? Because I can't design that for you because I don't know you, okay? But I would take a look at the article I've written about mold toxicity. It talks generally in there about how to proceed. And I would try to get a doctor involved. It's a pretty complex illness. And so I think sometimes it's good to have a physician involved helping us along the way with these things too, okay? The one thing I would say to you is if you have this much mold toxicity in you, you need to get a home inspection done. And if you work outside your home, you should get your work environment inspected as well too. You need to make sure that you are not living in poisons. And if you are, those environments need to be cleaned up as well too, okay? My general approach is when somebody has mold toxicity is to do things to correct sleep. I put people on things like curcumin to lower cytokines. If they have symptoms of low adrenals or low thyroid, I'm going to try to correct for those. And then I want to put them on a binder at a decent level to start removing those toxins. Now, after about 6 months of using a binder by itself, if somebody has not sufficiently improved, and if we do a repeat urine toxin test and they still have high toxins, then I might add in an agent to start killing mold spores that might also be living in you that you got from your environment that are producing toxins as well too. I will tell you though, most people that I treat do not need to be put on antifungals to kill mold spores that we sometimes breathe in from our environment that start producing toxins. Okay, those mold spores can live up on our nose passages and sometimes can live down in our intestines. But I've got lots of people well just using binders alone. So I know there's a number of my colleagues out there that will always put somebody on mold spore killers when they start treating for mold toxicity. I don't think that always needs to be done. My approach is generally to go binders first, see what happens over a 6-month period of time. If the toxins are not going down and if the home environment and work environment are clean, then I might start adding in something to kill mold spores up here in the nose and down in the intestines as well too. Okay. All right. Let me do a quick screen share here. Okay. So a good place to start in any of these illnesses with too many cytokines is to take a look at my Lyme support protocol. And the first parts of the Lyme support protocol are what I would do with somebody with mold toxicity, okay? Because again, these are all cytokine excess syndromes, all right? So first thing, do things to get sleep. I give you some ideas here that would also be useful during mold toxicity. Number 2, try to be on a healthy diet. I give you some ideas about that. Number 3, do things to control and lower cytokines, because again, they're giving you a lot of your symptoms. I talk about how to do that here. Number 4, be on something to help support your body to deal with the stress of it all. Ashwagandha is a good way to do that. Number 5, look and see if you might have adrenal or thyroid insufficiency. Often that happens in mold toxicity and in Lyme disease. Number 6, be on a good multivitamin. Number 7, do some basic detoxing, like eat organic foods, avoid gluten, sense alcohol. You might consider adding in liposomal glutathione as well too. Exercise if you can, but often it makes people worse at the beginning. And so I would do at least up through step 8. I might even do up through step 10. See if you have too many yeast in the intestines and get rid of those, because if you have too many yeast, that's going to add to the cytokine pool. Okay. And then you need to be on something to start dealing to bind up the mold, all right, or the mold toxins. And so to do that, I'm trying to go back up here. So take a look in my detox chapter and take a look at this article called Mold Toxin Illness. And in here, I review the various binders and ways to use binders as well too, okay? But given the complexity of all this, I really strongly advise you to see if you can find a physician that will help you work through this, okay? All right. Good luck to you. All right, let's see here. Hello, Colleen. Let's see. Hi, Dr. Ross. Your idea of upping my Candida treatment gradually totally worked, taking one additional phytostan pill every 3 days, then every 2 days, then every day. I was able to get up to a full dose without the big herx I had experienced previously. Great. I'm glad to hear that. I took it ridiculously slow, taking each next step up after a month on the previous step, but it went really smoothly this time. Unrelated question. About 7 years ago, I was told I had high oxalates, was then sent to the urologist who said everything was fine. Should someone who had high oxalates in the past be mindful of how much spinach, etc. they eat? I don't tend to overdo it on any one food and eat a low inflammation Candida diet. Thank you so much for sharing all your wisdom and advice. So it's hard for me to answer that oxalate question, because I would need to see how they even determined initially you might have oxalates. And obviously when your urologist went and looked at oxalate levels again, you didn't have the problem. So I would be inclined to, if you were seeing me, I would want to look back at both sets of tests. I might even be inclined to test again just to make sure it still isn't a problem or not. Okay. So it's hard for me to say. All right. Good luck to you, Colleen. Hello, Bob. Let's see. Hi, Dr. Ross. Have you heard of titanium dental implants causing autoimmune diseases or becoming toxic? I just saw a biologic dentist who states that us Lyme disease patients are more prone to having a negative effect with these implants, as well as root canals. Have you had any of your patients have any dental implants removed or any dental issues? This biologic dentist also stated that since I have Lyme, I should extract all teeth that have had root canals. Otherwise, I will never heal. Have you read any medical journals connecting root canals to blocking Lyme patients from getting better? Each zirconia implant comes at a hefty price of $10,000 each. Thank you. All right. So this kind of gets into a complicated area. So one of the problems with root canals is at the bottom of the root canal, you sometimes get these pockets where Lyme can live, and it's hard to get antibiotics into those pockets, and it can become a source of chronic inflammation throughout the body, basically. There are times when I've treated somebody with everything I know I can do to treat their Lyme, and they're still sick and they have a history of root canals. I will send them off to a biologic dentist and have the dentist evaluate as to whether they think there are infection pockets there. And if there are, treat the infection pockets. Sometimes that means a tooth removal. Sometimes it means doing hydrogen peroxide or ozone injections into those pockets. But at least I have it evaluated. I don't know that they need all to be removed the way your dentist is saying so here, okay? In terms of putting foreign objects into your body when you have chronic illness, whether that's breast implants, whether it is tooth implants, I generally suggest against it. Of titanium would have the one of the lower chances of getting into an autoimmune illness, but anything is possible. And you already have an immune system that's hyper turned on towards being autoimmune reactive in Lyme disease. And so I would tend to stay away from titanium implants. That's not an absolute, but that's what I recommend to my patient. Are there any science studies that have been done showing that what happens to people with Lyme disease if they have titanium implants? No, not that I'm aware of. And are there any studies that have been done looking at root canals and the experience of people with Lyme? Nope, not aware of that one either. But I do have the experience on those of knowing a number of people when we got their teeth out and they weren't healing, or if they got ozone treatments into their infection pocket under their tooth, it did make a world of difference and they started healing basically. Okay. So I can just share experience with you at this point. All right. Good luck to you, Bob. Hello, Dave. Dr. Ross, thank you for your devoted time to us Lyme patients. You're welcome. On the local news, they aired a story about a man with chronic infection of his prostate, which after 2 years of IV antibiotics, no cure. Through Baylor University, they have treated him with phage therapy and cured him. Is this treatment available for Lyme Borrelia infection patients? After doing research, I found in Tennessee a place called Biologic Center for Phage Treatment. They promote great success in this treatment from past experiences. I find this very questionable. Does phage treatment offer any hope for chronically ill people with Borrelia? So what phages are is for every bacteria that we have in us, there are viruses that will infect us that try to keep those bacteria under control. Okay, so for infections of the prostate, the various bacteria that could cause it, there are viral phages that should be able to keep it under control. I don't know exactly what they're doing at Baylor, but maybe they are. When they were doing their phage treatment, they were probably injecting these viral phages into a person to try to get rid of their infection. Okay, now, so there are no studies that have been done looking at a double-blind randomized controlled study looking at whether if we inject phages against Borrelia into a person, whether they will get better, okay? What is supposedly happening at the Biologic Center in their phage treatment is they are, for lack of a better way of saying it, they're using energetics, I believe an electromagnetic frequency machine of some kind, to turn on phages against Borrelia that are in a person to put the Borrelia back under control. Okay. And that's as I understand what they're doing. And the doctor that's ahead of that used to be head of the Hansa Center in Kansas, and for some reason has wound up over in Tennessee. And I have no idea why he moved. I have no idea whether he had trouble there. I have no idea at all. What I can tell you is this idea that you are going to electronically turn on or energetically turn on your phages to fight an infection seems a little hokey pokey to me. Okay. There is not true science, lab science behind that show that it actually happens. I know that the doctor that is at Biologic Center has published a case series where he followed people that he did his treatment to and claims that it shows that they got benefit. And it does. If you look at it, it does. However, there's problems with that kind of study. First of all, the person conducting the study is the person that has financial interest in the outcome and is the only person, the person that did the study is the one doing the treatment. So there is huge biases in how a person that has gone through the treatment is doing. Okay, there's a huge bias, and there's no way of knowing whether the fact they just get better is because they think the treatment's helping them. Okay, we actually don't know good enough about whether the research tool that was being used to follow their symptoms is an adequate tool. I have a lot of questions. Is it possible it works? It's possible, but there's no basic science that shows that it works. And the type of study that was done, a case series where no one else actually followed these patients to document how they were doing, other than the person that has a financial interest at the outcome of this, is a little bit questionable. Okay, that's my opinion on that. All right. Maybe it works. There's a lot of biases in this that just really have me questioning. And the idea that energetically you can turn on viral phages to attack Lyme germs, I think seems questionable as well too. Okay. My opinion. All right. Thanks, Dave. Good luck to you. Hello, Flavia. Let's see. Hi, Dr. Ross. Thank you for all your help. My son has Barton babesia. He is on rifabutin mornings or twice a day, 150 twice a day. He's also on doxy, azithromycin, malarone, liposomal glutathione, curcumin, doing saunas and detoxing. Most of his symptoms are getting better, but still has severe brain fog. We've added rifabutin since November 11th. Do you think his brain fog is due to the toxins or the bacteria? Should it get better increasing the dosage for rifabutin? So the brain fog, as you know, earlier tonight I was talking about cytokines, right? And cytokines are good and bad. Again, they're the inflammatory chemicals that are made by the immune system trying to deal with these infections. Too many cytokines give you brain fog. Okay, so one cause of brain fog is too many cytokines. Another can be just inflammation within the brain tissues itself, and that could be caused by the infection. In terms of toxins possibly doing it, maybe, but it's hard to say. I think it's more of a cytokine issue, and it's also that the infection is causing neurologic dysfunction, incorrect functioning of the nerves in the brain. All right. Now, it's possible going up to a higher level of rifabutin might help. It's possible. It may not. In my experience, what I'm starting to see, and I've used lots of rifampin and rifabutin, they're of a family called the rifamycins, and they are effective against Bartonella. But I'm starting to find for those people that I've done that kind of a treatment before, where we've used a rifabutin with an azithromycin, for instance, and I'm not getting good breakthroughs on the brain fog, even at higher doses. Sometimes I have found benefit using an azole like Diflucan or itraconazole. Azoles can also treat Bartonella based on research that was done at Johns Hopkins University. So the azole family, we tend to think of those as being the antifungals. At Johns Hopkins about 4 or 5 years ago, in laboratory experiments, they used an agent called clotrimazole, which is found in vaginal yeast creams, okay, and on creams to do vaginal yeast infections and fungal infections of the skin. That's what clotrimazole is used for. But in the lab, they used it to see if it would do anything for Bartonella, and they found that it treated growing Bartonella and it treated hibernating, or what we call persister Bartonella as well too. It's not available in an oral form. Some of my colleagues had it compounded into an oral form, but the truth is it's just horribly absorbed. About a year or so ago, I decided to start using another type of azole. Knowing clotrimazole worked well in the lab, I decided to try fluconazole, which is something we use to treat yeast. And I also have subsequently used itraconazole, which is a brother or sister of the fluconazole. And I have found a number of my patients get good lifting of the brain fog when other things haven't been working. So for instance, in this type of a treatment, if I were to substitute it in, I would probably pull out the rifampin and add in fluconazole. Okay, if I had a treatment like this on a patient, that's where I would probably go with it. Okay, Another option to consider is you're not getting any further with the rifabutin in terms of the brain fog, is to look at using methylene blue. Methylene blue also has some good track record at helping to clear the brain fog when other things aren't doing it. So methylene blue is a medicine that would have to be made by a compounding pharmacy. It's manufactured in an intravenous form because it's used to treat a different condition. It's not made to treat infections, okay? What it's made for is to treat people with a condition called methemoglobinemia. In methemoglobinemia, hemoglobin, which is the protein in the middle of your red blood cells, its job is to bind oxygen and carry it in the middle of the red blood cells so it reaches the tissue. With people in methemoglobinemia, they get into periods where the hemoglobin just won't let go of the oxygen, and they become oxygen starved in their tissues. In a crisis, to help bump that oxygen off of the hemoglobin, we will give them IV methylene blue. Okay, that's the purpose of methylene blue. But there are studies that show methylene blue also destabilizes the covering of germs, and that's how it can work on growing and non-growing forms of a germ. So it has some antibiotic properties. And so when we use it in a standard adult, I will wind up using it at 50 milligrams twice a day. Sometimes I'll go up to 100 milligrams twice a day on it, okay? If you're to do methylene blue as an alternative, the one thing you have to do is do a blood test first before you do it, a test called a G6PD test, or also known as glucose 6-phosphate dehydrogenase. It's a mouthful, I know. But anyhow, glucose 6-phosphate dehydrogenase, you have to do that and see if there's an adequate amount in your red blood cells. If you don't have enough G6PD, it's an antioxidant. If you don't have enough of it, you could, and you take the methylene blue, it could lead to hemolysis or rupture of your red blood cells. You have to do that as a precaution, okay? So with this type of a treatment, alternatives I consider in my patients are, if the brain fog is not budging, is to pull out the rifabutin and do a Diflucan or do a methylene blue, okay? That tends to be where I tend to go, and I find good results usually with one of those two agents, okay? All right. You can read, I have information about methylene blue. Actually, you may want to take in writing my book and doing the compilation of articles, there's a number of updates that I did to the articles in the book that are not yet showing up on the website, okay? So I did update the Bartonella article, and in that update, I do have stronger information about methylene blue and stronger information about the azoles and how to use them. You probably can find that still in the existing online version, but a cleaned up, stronger article regarding those is within my book, the chapter called Kills Bartonella within the book. I will eventually, as time permits, I will get around to updating the online version of my Bartonella article to correspond with that, but probably the better way is to get the book and look at how I wrote it there. Okay? All right. Good luck to you, Flavia. Good luck to your son. Hello, Devon. Let's see, or Devin, I should say. Are there any electrolyte mixes that you recommend, or how do you make your own? It seems very confusing when I need magnesium, potassium, sodium, etc. I don't recommend specific electrolyte mixes. I guess I can't respond to this one. I would need to know more why you're asking this specifically. If you're asking it, so for instance, for my athletes that go out and do a lot of exercise and sweating, I just have them get electrolyte drinks like Gatorade, or I have them just get any kind of electrolyte packets. I don't have a specific response to this one. I'm sorry. Good luck to you. Hello, L. Let's see. Happy New Year. Do you think there will be more boosters coming for COVID? Do you recommend regular boosters for those with tick-borne infections? All right. So I don't have a crystal ball on this one, but I would anticipate as long as COVID is out there circulating and causing bad health problems, we will probably see more boosters coming down the road. All right. Now, as to whether I think everyone should get boosters, not uniformly. And it's something that I think I have to have discussions with each of my patients and see. Number one, I need to know how they responded to previous vaccines. And if they did not handle those well, then I may be less inclined to recommend a booster at this situation. So I need to get more history from a person to see whether I recommend that or not. As the other thing is really going to be determined on is, even though we may have a lot of COVID out there, if it's not hurting people because there's still enough remnant immunity from our previous vaccines and boosters, and from maybe getting low-level COVID that some of us may pick up in the community right now, it may be that our immune systems will be set up adequately over time, and that the strain of COVID may get less virulent, that we don't need to do vaccines or boosters in the future. So to me, there's a lot of unknowns right now. Okay. All right. Good luck to you all. Hello, Monica. I've seen in previous webinars that you prefer using natural binders instead of cholestyramine due to constipation side effects. My doctor just prescribed cholestyramine to treat mold. Should I take Metamucil to help with the proper bowel movements, or would you recommend what do you recommend patients to assist with the side effect or any other side effects this drug has? So, the big problem with cholestyramine. So cholestyramine is good in the sense that it is a broad spectrum binder. It can bind a number of different types of toxins. By that I mean ochratoxin, aflatoxin, trichosethene. It has the ability to cover a wide range of toxins. Okay. The problem is it tends to be a very constipating medicine for people to take. So what I tend to do is I tend to have people that are on cholestyramine try it and see. I mean, not everyone gets constipated on it, but a lot of people do. If a person starts getting constipated on it, my first step is to have them take magnesium, anywhere from 400 to 600 milligrams at night. And I might have them do another 400 to 600 milligrams in the day. And if that's not keeping them loose enough, then my second step, in addition to that magnesium, is to start adding vitamin C. Vitamin C at higher levels leads to loosening of the stools as well too. And so we're talking doses of like 3,000, even up to 10,000 milligrams of vitamin C. All of us have, the thing about vitamin C, all of us have a certain tolerance level, but somewhere between 3 and 10,000 milligrams a day of vitamin C, we all start to get some loose stools. Okay. Each person is a little bit different. Some people, it could be at 5,000 milligrams. Other people, it could be at 10,000 milligrams. And the way you can do that, you can you can get buffered vitamin C. I would not do straight vitamin C. I would do buffered vitamin C tablets to do that. Okay. And you can mix that with your, with the magnesium at the same time. Okay. All right. Good luck to you, Monica. Hello, Mosby. Let's see. Whatever happened to gram-positive and gram-negative antimicrobial peptides? Seems like they just vanished when 20 years ago they were supposed to replace antibiotics. Do you ever hear of them being used? No, I don't. The only, I guess the main antimicrobial peptide that a lot of current practitioners that do injectable peptides use is something called LL37. But that is only available in an injectable form, may have some antiviral, antifungal, antibacterial properties. I have not seen any studies done, though, showing its effectiveness in people with Lyme. But I am aware of that peptide, but I'm not aware of other peptides like you're talking about. Okay. All right. Thanks, Mosby. Good luck to you. Julie says hello. Hello, Julie. Hello, Tom. Let's see. I have positive hygienic tests for Bartonella, Babesia, and Borrelia. I was completely bedridden for 2 years. After that, for a year and a half, we made good progress and got me out of bed for 6 hours a day. 1 year ago, I had major relapse and lost my ability to self-transfer. I still get out of bed twice with a Hoyer, also gained extreme dizziness and head pain in the back of my head. The extreme dizziness and head pain have been lasting for over a year. Have you ever dealt with a case of Lyme, Bartonella, or Babesia that had extreme head pain and dizziness that lasted longer than a year? Specifically to answer your question, no, I have not. Some things for you to consider that I always try to make sure of before I start going back into the Lyme, Bartonella, and Babesia treatment pathway with my patients. If I've got somebody that's been doing a lot better and then suddenly out of nowhere, unexplainable, they start doing significantly worse with even headaches and pain, dizziness, all this stuff that you're having, I want to make sure to consider whether they develop too many yeast living in their intestines. About 80 to 90% of the time that I see somebody that either I got 100% well and then they start having quote unquote relapse, or they've gotten really a lot better and suddenly everything goes haywire. About 80 to 90% of the time in my experience, I will start questioning them and discover that they might have too many yeast in the intestines, and then I'll treat for the too many yeast. Okay, so you may be wondering, well, what's that? What does that have to do with anything? Well, remember at the beginning of the webinar tonight, I talked about cytokines. And I said things that can trigger too many cytokines in your body are mold toxicity, Lyme, Bartonella, Babesia, too many yeast living in your intestines. Everyone that gets treated for Lyme, whether you're on herbal antibiotics or prescription antibiotics, you are a setup for getting too many yeast in your intestines, even if you're on probiotics. And even if you stopped your antibiotics 2 years ago or 3 years ago, you still have some disruption of the good bacteria in your intestines, and you're set up for a long time to get too many yeast in your intestines. So the first thing I always try to consider with somebody that gets into a major decline is, did too many yeast move in? And so I'm going to consider things like sugar cravings, intestinal gasiness and bloating, changes of the skin leading to pimples and acne. I'm going to review all the symptoms that could suggest too many yeast. I showed you that article earlier tonight. You might want to go back and look at that again too. Okay. Something else I will consider when I get into these, especially when I get into bad headache situations like this, is I want to know if suddenly your home has developed some water damage issues and you now are sitting in a bed of toxins, basically. Okay. So you might want to go back. I have my patients go back and look at their home, make sure we haven't developed some kind of a mold toxicity problem along the way too. Okay. And then finally, you have to reconsider, maybe it is that we've got into a Lyme or a Bartonella relapse. But before I go there, I always want to make sure about yeast, and I want to make sure that we thought about whether there might be some mold toxins that came into the problem as well too. The people I have seen that have had the most significant head pain problems, the kind of head pains that are not manageable with narcotics, for instance, or regular pain controllers, a great majority of those are people that have had mold toxicity, or have mold toxicity. Mold toxicity can give some very severe headaches. The other condition that sometimes can give severe headaches is active Babesia as well too. So you might want to take a look at the article I've written about how to diagnose Babesia, where I review a lot of the symptoms that you can see with Babesia and see if any of those are active as well too. Okay, let me do a quick screen share here for you. All right. So again, if you're interested in trying to figure out if you might have too many yeast, take a look at this article here. Okay. And then in terms of how do you diagnose Babesia, what are the symptoms that make you think of Babesia? Take a look at this section here called How to Diagnose. And then take a look at my article about how to diagnose Babesia. Now, I can tell you right now, I've got to do a laboratory update of this article. IGeneX has developed in the last 6 months, has developed a test called an immunoblot for Babesia, which is probably the better way to test for Babesia now. But in terms of looking at symptoms, this article is accurate on the symptoms that you would use to consider if you have Babesia. Okay? All right. If you're wondering why I haven't gotten around to updating the article yet, I've really been consumed trying to get my book compiled and get that out. But now I have time to start looking at some other assets of these other assets on my site and get some of them cleaned up that need to be updated. This one needs to be updated in terms of the testing. Okay? All right. Good luck to you, Tom. Hello, Gemma. Let's see. Hi, Dr. Ross. I hope you're feeling better. I am. So, for those of you that were here last week, about this time in the webinar, I just started having a lot of coughing, and it got a lot worse over the next 48 hours. But I'm on the mend, so thank you for that. Let's see. Hi, Dr. Ross. I hope you're feeling better. I'm wondering what infection might cause this, and what may help. It feels like there's a line down the center of my body dividing it in two. I'll have brain and face pressure on one side with a dead, crampy, swelling feeling in the muscles, and veins and arm on the leg on the same side. The next day, it switches to the other side. I asked because I was doing much better after the initial die-off from clarithromycin, doxy, rifampin, malurone, and serapeptase until 25 milligrams of Japanese knotweed, I assume you mean Japanese knotweed root powder, was added. These symptoms started by the third week, making me housebound again. I've been treating for 1 year, 2 months. Thank you. All right. So I don't know for sure. And I would need to ask you a lot of questions to help me understand a little bit better, but I'll make one general observation for you. Many of you may be familiar with the physician named Richard Horowitz that wrote a book, Why Can't I Get Better, or something like that, about Lyme disease. Dr. Horowitz also is the person that came up with the DAPSOME protocol that many of you may be aware of as well, too. When he wrote his book about Lyme disease, one of the things he includes in there is the Horowitz MSIDS questionnaire, or you could call it the Lyme questionnaire. And after he developed that questionnaire, he tried to validate aspects of the questionnaire to figure out which questions in there might have the most relevance in determining if somebody had Lyme or not. Okay, so one of the things he was able to determine is that people that had wandering pain or wandering neuropathy, where it was one place one day, another place the next day, that those people that had the wandering symptoms, kind of like you do, okay, that's highly indicative of the Lyme infection. Okay, so I would think of Lyme infection. Now, why the Japanese knotweed may have gotten it worse, the only thing I can think of is with this treatment that you're on of the clarithromycin, doxy, rifampin, malurone, serapeptase, you haven't been on anything that is dealing with what I call persister Lyme or persister Bartonella. So let me just talk about that real quick. So we recognize now that the Lyme germ and also Bartonella have two different growth phases. The growth phases are growing and hibernating, or we call those persisters, okay? About 90% of the germs probably are in these growing phases, and then about 10% can be into hibernating phases, okay? Now, to confuse it further, the Lyme germ, in addition to having growing phase and persister phase, has different appearances or different looks, okay? So the Lyme germ has a look that is a spirochete. It's a corkscrew-looking thing, all right? Another way the Lyme germ looks is it has a microscopic cyst form or ball form of the germ. And another way that it looks is it gets rid of all of its covering and it moves inside of cells. And without its covering on living inside of cells, we call that an L form. So there's three appearances to the Lyme germ. The spirochete and the cyst can either be growing or in a persister state, okay? The intracellular L form we do think it can be growing. We don't have any science that says for sure whether it is persister or not. Okay. All right. So the Japanese knotweed has some studies out that came out this last year, about a year ago now, laboratory experiments out of Johns Hopkins University that showed that it's effective at treating growing Lyme and Bartonella, but it also treats persisters. All right. And it could be that you've built up a pool of persisters, and that knotweed is just doing a great job of killing them, triggering excessive cytokines, or we call that a Herx reaction. If you were in my practice and I had a patient with the same kind of situation, I would probably be dialing back on that Japanese knotweed and to try to find a level you could tolerate that wasn't beating you up like this. It makes me wonder if you're having an excessive Herx as the knotweed is getting at some of the persisters. It makes me wonder that. I don't have a way of proving it, but it does make me wonder that. Okay? All right. Good luck to you, Gemma. Hello, Al. Let's see. This is not a Lyme question, but I value your opinion on all the cholesterol controversy out there. Some docs from the Weston A. Price camp say eating eggs and dairy is not bad for you. Some docs say avoid eggs and whole milk like the plague. Do you have insights into this confusing issue? So the whole cholesterol thing is tricky. I'll just start by saying that. So cholesterol can be good, right? We need cholesterol to make a lot of our hormones. It's the building block of most of the hormones in your body, especially your sex hormones, all right? So we don't want to totally get rid of it. And the other thing I want to make you aware of is that your cholesterol levels, only about 10% of your body's cholesterol levels are influenced by what you eat. Only 10%, all right? 90% of your cholesterol levels are what are made in your liver. Your liver makes this stuff naturally, and it's not dependent on whether you're having eggs or not, okay? So in managing patients with cholesterol as a primary care doc, which I used to be years ago, I would have people take eggs. I think that there's okay to have one or two here and there. I don't think it means we need to knock them out altogether. If we start knocking out all cholesterol, then you may impair some ability to make the sex hormones, actually. Okay, to be honest with you, right? Where I have problems right now is the studies do show that if you lower cholesterol, you decrease cardiac events, meaning heart attacks. But we don't have any study. What's interesting, though, is with all this cholesterol lowering we've been doing, we have not prolonged life. We haven't changed the overall health status of people. The only thing we've done is we've changed that they don't get as many heart attacks. All right. So I think you need cholesterol to help balance health, right? And right now, part of our problem in this country is a lot of our viewpoints and expert panel opinions are basically by people that have been promoted by the drug industry getting on these panels and advocating a certain position. And if I may be so bold as to say, there would probably be a group of people out there related to the pharmaceutical industry that would like to add statins to our water the way that we add fluoride to the water for teeth. I mean, there is a camp of people out there that think that statins are going to save the world. But statins, the main drugs that we use for treating cholesterol, may lower them too much, and then we have hormone problems. And those statins also have a lot of muscle achiness problems. There's a whole host of problems with statins, basically. So I'm not a big advocate of them. I think we probably have gone too strong towards preventing heart attacks, and we may be leading to other problems because we haven't really caused overall adjustments in people's level of health. Okay, so anyhow, that's my opinion. But I think it's okay to have eggs. I think it's fine. Okay. And again, it's only because that only alters 10% of your cholesterol levels anyhow. All right. Good luck to you all. Hello, Gene. Is it possible chronic Lyme to jump into psychosis? So psychosis, acute mental crisis, acute mental health problems. Yes, the Lyme infection can cause that. But when you see severe mental health, you have to wonder if Bartonella is part of it too. All right. So most of us that treat Lyme, if we see severe mental health, recognize that Lyme infection can lead to it, but also we're very aware of Bartonella causing it. And most of us, even if testing is negative, will do things to cover for, treat for the possibility of Bartonella being in the mix. Okay? All right. Good luck to you, Gene. Hello, Astrid. Happy New Year, Dr. Ross. I am currently, Happy New Year to you too. Let's see. I am currently taking Hutania, Sedacuda, fluconazole for Bart and Lyme. What will the fluconazole do for me besides fight yeast? Also, I'm not able to tolerate cinnamon, clove, and oregano. Is there another biofilm buster you recommend? Okay, so fluconazole, I was kind of talking about this earlier tonight, but we know that fluconazole treats yeast. Okay, it's part of the family of the azoles. We know from the Johns Hopkins experiments that clotrimazole, brother sister of fluconazole, is useful at treating growing and persistent Bartonella. I'm finding fluconazole does a great job with Bartonella in my practice as well too. All right, the azoles also have activity against the cyst form of the Lyme germ, and traditionally most of us have used metronidazole, which is flagyl, or tinidazole to treat cyst, but I use my fluconazole to treat the cyst form of Lyme too, knowing that those other azoles treat the cyst form of Lyme too. So in my treatments, if I've got somebody on fluconazole, I recognize it can help with yeast, it can help with Bartonella, and it can help with the Lyme cyst. Okay. All right. Now, I have no laboratory information as to whether the azoles are useful against growing and persister. I think they help with growing, but I don't know from laboratory experiments whether they help persister Lyme. I do know from laboratory experiments they help persister Bartonella and persister, but I don't know about persister Lyme. I do know that from laboratory experiments they kill growing Bartonella, and I see clinically I think they treat growing a Lyme as well too. Okay, all right. And again, on the Lyme side, we're using it mainly as an anti-cyst agent. Okay, all right. All right. And then in terms of the cinnamon, clove, oregano. Okay. So the cinnamon, clove, oregano, I use primarily in my practice to treat these persisters. It is also true they might remove biofilm. So these are two distinct problems. Okay. So as I mentioned earlier tonight, Lyme and Bartonella have two growth phases. All right. So there's growing, and then there's 10% that go into hibernation. All right. In addition, Lyme germs have the ability, and even Bartonella has the ability to grow a slime layer over it. And that slime layer is held together in a protein skeleton made up of blood clotting protein called fibrin. All right, so you got this mucopolysaccharide slime kind of kept together with these protein fibrils from fibrin, and they cover germs. What's also true about these biofilms is in the biofilm itself, there's a bunch of bacterial communities that are non-Lyme bacteria, non-Bartonella bacteria, but a whole bunch of hosts of all kinds of bacteria. And in some ways, the biofilm is a village. Certain bacteria take on the post office function. Certain bacteria act as the sanitation department. They literally have complex functions within these biofilms. And so what the cinnamon, clove, oregano can do is help break apart the biofilm. And in addition, the cinnamon, clove, oregano can treat persister Lyme and persister Bartonella. Okay, so other things that can treat persister Lyme and persister Bartonella are Japanese knotweed and Cryptolepis. And that's based on laboratory experiments that were conducted at Johns Hopkins earlier this year. Okay, now Japanese knotweed and Cryptolepis, I don't have any information about whether they treat biofilm though, but they will treat persisters. Okay, so if I'm going to do a Japanese knotweed, I'm going to usually do 30 drops twice a day. My Cryptolepis, I tend to dose it pretty aggressively. I'll work people up to about a teaspoon twice a day, even a teaspoon 3 times a day. You may be familiar with Cryptolepis as an herb that we use to treat Babesia, because that's what we historically have used it for. But the Johns Hopkins lab experiments that came out earlier this year, or last year, I should say, show it's effective against growing Lyme, persister Lyme, and it's good against growing Bartonella and persister Bartonella as well too. Okay, all right. You can find information about Cryptolepis in my persister article. Okay, I'll show that to you here real quick if you want to read a little bit more about it. All right, so let's see here. I'm going to go to my infection treatment plan section, take a look at this article, How to Treat Persister Lyme and Bartonella. And in here, I talk about Japanese knotweed, and I talk about Cryptolepis as things you can use for persisters. And again, they also treat growing as well too, okay? All right. Good luck to you, Esther. Hello, Margaret Lee. See, my daughter has Bart, Babesia, and Lyme. I think I may have answered this already. Oh, no, it's a different question. Okay. Let's see. My daughter has Bart, Babs, and Lyme. She has been on azithromycin, rifabutin, cefixime approximately 5 months. She was recently placed on tinidazole for the cyst stage of Lyme, but at the same time taken off of cefixime. This does not make sense to me because if the Lyme cysts are being broken open, doesn't she need an extracellular antibiotic to kill the Lyme that is released? I was reassured she would go back on cefixime in a couple months, pulsing. Won't she feel worse if Lyme is released from the cyst and there is nothing to kill it off? Can you comment? Thank you for all that you do for the Lyme community. Okay, let's talk about this again. Okay, so Lyme has 3 different forms. Okay, so there's Lyme that lives inside of cells. That's called an L form. It doesn't have a covering at all. Okay. Another way that the Lyme appears is it has these microscopic cysts, but that's a Lyme germ. There isn't Lyme living in this. The cyst is the Lyme, okay? And then another appearance is the spirochete, okay? Now, so Lyme lives outside of cells and inside cells. Inside of cells, it lives as this L form without a covering. The kind that live outside the cells are the spirochete and the cyst. Okay, now, in terms of things that get at Lyme inside and outside of cells, I should say get at spirochetes and L-form Lyme. There's something that deals with spirochetes and L-form Lyme, and those are either macrolides, which are clarithromycin and azithromycin, or doxycycline and tetracycline, okay? So the tetracyclines and the macrolides get inside of cells to deal with L form, and they get inside of a spirochete that's living outside of cells, and they block its protein production. So that's how it kills the spirochete. Okay, all right. Then for the cyst, things that we use that for cysts that live outside of cells would be grapefruit seed extract, the azoles that can do it. Okay, now cefixime is a cephalosporin. And what cephalosporins do not get inside of a cell to treat L form. And also the cefixime does not get inside of a spirochete. What it does to the spirochete is it impairs the spirochete's ability to repair its covering as the covering gets damaged. So it's known as an extracellular antibiotic that works on the wall of the spirochete from the outside, all right? But in this treatment, if you stop cefixime, both azithromycin and rifabutin can get inside the spirochete, outside the cell, to stop its growth. Okay, so you've already got something that's working at that. And the tinidazole is getting at the cyst. So you're not going to have something that's going to burst open all of a sudden and result in more spirochetes down the road that you have to treat with another agent, basically, okay? In other words, what I'm trying to say to you is you have adequate coverage, all right? And you just have to recognize the cefixime is only going after the spirochete outside of cells by punching holes in the covering. But on this regimen with the azithromycin rifibute, you've got something that's getting inside the spirochete, getting at that as well too. Okay. I hope I didn't confuse you too much there, but I think things are fine at this point. Okay. All right. Good luck. Good luck to you, and I think good luck to your daughter. Okay. Hello, Adrienne. Hey, doctor. I'm currently using Cryptolepis for Babesia and Bartonella and was wondering if there is added benefit using the Crypto Plus. Also, if I'm using lumber kinase, is 1 hour enough a wait time before using Cryptolepis? Thanks. So lumber kinase, everyone you may be aware of, is a group of enzymes that are made from the covering of a skin covering of earthworms. It's a crazy illness that we got to use earthworms, but what the lumber kinase can be used for is to break down the fibrin in your biofilms. So it's a way of treating biofilms. It's also useful in in Babesia and Bartonella for treating a separate problem that can develop, which are known as fibrin nest, where fibrin, the blood-clotting protein in your blood, mixes together with Babesia and Bartonella, and you get these nest of fibrin and Bartonella Babesia germs, and they're kind of walled off in there, and they stick themselves on your blood vessel linings, and then it's hard for the antibiotics and the immune system to get in at them. And the lumber kinase breaks down the fibrin in those too. My general rule of thumb that I tell people in my practice about lumber kinase is it's best if it's on an empty stomach, because if you take it with something other than water, it's going to try to digest that something that's in your stomach, okay? So I generally say, beginning 1 hour before you take your lumber kinase through 1 hour after you take your lumber kinase, you should have an empty stomach. You should not be eating any food, medicines, or supplements. Water is okay. Okay, that's the guideline I use. Okay, and then in terms of the Crypto Plus, so Crypto Plus is a compound that comes from Research Nutritionals. And in the Crypto Plus are a number of other herbs that might treat parasites and also treat Bartonella can be in there as well too. In fact, let's go look and see what else is in it. What I will tell you in my practice, I tend not to like, even though I carry this product because a number of people are interested in it, I tend not to like to use compound products because if something goes haywire, I don't know which compound is doing it within this complex. Okay, so I tend not to use them. So I don't have a lot of working experience with the Crypto Plus. If I want to use Cryptolepis, I'm going to use it as a separate herb. And that just tends to be my own philosophy, basically. Okay, all right. Let's do a quick screen share here, though. Actually. Okay, so this is my supplement store, and anyone can buy from here. I think many of you know that. But if you're ever wondering when I talk about curcumin, which product I recommend, you can type in curcumin here. You'll find the various products. In terms of Cryptolepis and this Crypto Plus, I'm just going to type in crypto here. Oops. So this is the Crypto Plus. This is the product from Research Nutritionals. And in terms of what is in it, so this has got Cryptolepis. It's got Lomadium, Cianthus, Hugens nigra, and Stillingia. Okay, the Hugens nigra is black walnut, which is useful as an antiparasitic. The red root is an herb that can help improve blood flow, supports the blood vessels, which might be helpful more in a Bartonella type situation. Bear with me. I got to look up what the Stillingia and the Lomadium do. So hold on just a minute. Let me go back here. Okay, so this table says a few things. So the Lomadium is antiviral. It supports the immune system and helps improve circulation. Okay. The Stillingia is useful at lymphatic detox. Do I think in terms of your Bartonella and your Babesia, you would get any real added advantage from some of the things in here? I don't think so. I think your greatest thing you're going to get advantage from is the Cryptolepis. Okay. All right. Good luck to you, Adrian. Hello, Karina. Let's see how Dr. Ross. Today is my first time in your webinar. Oh, wow. Welcome. I guess I'm getting to you a little bit late here, almost 5:17 in the evening my time, but I'm glad we got to your question. I should have mentioned earlier, I have a hard time getting to everybody's questions. There's a lot of questions that get asked here, but I'm glad we're getting to yours. Let's see. Today is my first time in your webinar. I'm very grateful that you do this. How do you feel about DNA connections as a diagnostic tool, and can you use it to monitor treatment? I assume that after a while, the DNA of the different infections will be broken down, but I have not been able to find any studies or data to tell me what that time period would be. Okay, so I don't like DNA connections. I'll just start by saying that. So whenever we do a test or develop a test, whenever an independent company like DNA Connections develops a test technique like their urine PCR testing for different infections, one of the things that an independent lab is supposed to do is to do studies to validate that their test is accurate. And a validation study involves taking samples that are known and some that are known not to have the infection. All right. So some of the samples should be from people that have Lyme. We know for sure they have it. And some of the samples should be from a person that doesn't have Lyme, for instance. Okay. And then you use their technique to figure out, do they accurately predict which of these samples has Lyme and which one doesn't? Okay. Or we could say Bartonella or Babesia. All right. But they're supposed to do those kind of studies. They didn't do those studies from samples of humans that have Lyme. They've never done those studies. So I don't know what their testing means, actually. I can tell you IGeneX, whenever they develop a test, do validation studies. They try to show that their test does what they think it's going to do. All right. DNA Connections, when they first came out, I used to get a number. They did a great job of marketing their testing primarily to integrated medicine doctors and naturopathic physicians. And a lot of those physicians didn't do what they should have done, which is you do diligence with a lab that's new. You ask them, show me your data that shows me that your test works. Show me your data that says it's accurate against samples that are known and not known to have the illness. Okay. And so I was getting a number of patients that were coming to see me, bringing in tests that were done by other doctors as showing that they might have Bartonella or they might have Babesia. And when I started talking about their symptoms, there were no symptoms suggesting Bartonella Babesia. And yet here this test says Bartonella Babesia, right? So I really started me questioning about whether I'm getting false testing out of this lab, inaccurate testing out of this lab. So I called them up and I asked them, have you done human validation experiments? And they hadn't. So I don't trust the lab at all. Okay, so that's what I would say. So I wouldn't use them for anything. I wouldn't use them for diagnosing, and I wouldn't use them for following how you're doing. Okay, all right. Good luck to you. Hello, Adrian. Again, one other question, doctor. If we are using herbals to attack Lyme and co-infection, what blood work should we be doing regularly? Which harmful effects are most seen with herbal approach, cryptocytotonia? I'll be honest with you. What I do with my patients that are on herbal antibiotics is maybe about a month after they're on them, I will do a blood count and I will do kidney liver testing. And if it's normal, I don't go back and check again. I have not seen anyone, it's not to say it couldn't happen, but I have not seen anyone develop liver, kidney, or bone marrow toxicity from being on these various herbs. Okay, none. But I do a screen after a month, and then if that's normal, I just let it be. Okay, that's my practice. That's what I do in my practice. Okay, all right. Good luck to you. So, Mindy, let's see. I took an HTMA and provoked with DMSA urine test over 24 hours and learned I have very high lead and reasonably high mercury. Do I SOT my reactivated EB infections and Babesia or just go ahead with metal detox? I tried DMSA but ended up with scary severe muscle cramping from mineral deficiency. I took DMSA for about 2 to 3 months before reacting badly and getting very weak. Now I'm not sure how to handle metal toxicity. Zeolites, I believe the heavy metal toxicity came from taking 2 tablespoons of clay daily for mold toxicity. Okay, so first of all, there's a number of things here. So I don't believe in SOT. We're late enough in this webinar. I've mentioned it a number of times why I don't believe it. I'm going to refer you to my SOT article. I think that the company that has developed this has not shown that their technology works, and there's many reasons to believe it should not work. All right, so that's all I would say. So I'll do a screen share in a minute so you can review my full review about SOT. I'm not going to take time in the last 7 minutes of our webinar to go through that. All right. In terms of the heavy metal toxicity, it depends on where you got your source for your bentonite clay. There are some companies that don't do a good job of clearing out or screening for heavy metals. There are some that do. So you've got to be careful about your source of your clays because they might have heavy metals in it. So could you have gotten heavy metal toxicity from the clay? Possibly. It might be possible. I don't know the brand you used, okay? Also, there are other chelating agents you can use besides DMSA. Prescription-wise, there's something called DMSO. There's something called EDTA. And those are things you might want to talk with somebody that has and does a regular part of their practice doing heavy metal detox, okay? So those are just some thoughts for you, all right? All right. Good luck to you. I'll show you my article on the SOT. All right, so this is my article on supportive oligonucleotide therapy or SOT treatment for Lyme disease, where I review what it is and why I don't think why I think it has a bad chance of working, but also the fact that there's no proof done. There's no studies that have ever been done showing that, and even in a laboratory, showing that this works on people with Lyme disease. Okay. All right. Hello, Frank. Let's see, Dr. Ross. Thanks for all the information on your website, in particular the search engine. It's very effective to help me navigate things and quickly find what I'm looking for. I'm glad. You know, I had that added when I first designed the website. So it's a quick way. I mean, you can either use that huge mega menu and try to figure out what category I might have put an article in, or you just search what you're looking for in that search bar, and it usually does a pretty good job of finding things. So good. I'm glad that works for you. See, I've been taking biocidin liquid for a possible Candida overgrowth and have worked my way up to the recommended 10 drops 3 times a day. Along the way, I've been experiencing sugar cravings I didn't have before. Is this normal, and how important is that I avoid sugar during treatment? Also, I've been taking BPC 157. Does it matter if you take it or any other peptides with food? Thanks. Okay. So in terms of killing yeast, there on occasion, not everyone, okay, but occasionally I will see a person, no matter whether we're using herbal antifungals, anti-yeast medicines, or prescription anti-yeast, antifungals, occasionally killing yeast triggers more sugar cravings. And I don't know why, but it does, okay? In terms of my guidelines, if I've got somebody this is like one of the first times they've had yeast overgrowth, the main thing I do with diet is I recommend avoiding simple sugars, okay? And that would be things that obviously have had tons of sugar added to them. So I'm talking cookie, candy, cake, ice cream, the things that somebody has dumped tons of sugar in during the manufacturing process, okay? All right. If I get into a situation where I've got somebody that has recurrent yeast and I'm having a hard time getting under control, then I might go more towards a paleo type diet that removes grains, beans, and legumes to try to even limit further the amount of carbohydrates that are getting to those yeast, okay? But I don't start there right away. I also, in terms of limiting sugars for anyone, I avoid fruit juicing and vegetable juicing because that's just straight sugar. But you can have whole vegetables and you can have whole fruit. And the thing that makes them different from juicing is they have fiber attached to them that keeps those sugars from being easily absorbed. Okay. All right. In terms of the BPC 157, you can take it with or without food. It doesn't matter. At least that's how I'm using it in my practice. Okay. All right. Good luck to you, Frank. Hello, Mindy. I wondered with osteopenia, what is your opinion for a postmenopausal female on taking calcium and HRT? For osteopenia means thinning of the bones, not of the severity we see in osteoporosis, where you have a lot of thinning of the bones and great risk of fracture developing, okay? So the things that support your bone growth are calcium, and I have people take up to 1,200 milligrams a day when they're in menopause or perimenopause, and weighted exercise, something that puts weight-bearing exercise. So things that stretch your muscles. I can be doing strength training in the gym, weightlifting. It can be swimming because that puts force on your arms. It can be walking and running. But you want to do some kind of exercise that has some weights and pressure that are put on your muscles and the bones, okay? And if that's not doing well enough, and then I might consider doing hormone replacement therapy, estrogen-based hormone replacement therapy for somebody, okay? But my first line would be to increase activity, strength training, and being on calcium supplementation as well, okay? All right. Thanks for the question, Mindy. All right, everyone, that's it for me for tonight. I've enjoyed being here with you tonight. Next week, I'm actually going to be doing the webinar from the road. I'm going to be back down in Austin, Texas next week, so I'll have to find a location to go ahead and host the webinar, but it won't be this surrounding, but I will be with you in a week. And so I look forward to that. Tomorrow morning, when you get your email from me announcing that the recording has been edited and ready for your review, you'll also have a link to sign up for next week's webinar as well, too. Okay. I hope you all have a good evening. I've enjoyed being with you here tonight, and I look forward to sharing next Wednesday with you as well. All right. Goodbye, everyone.